Thank you all for using this course. We hope you're finding the answers to many of the questions you're looking for. At that, this course helps you gain better skills in academic writing and discover new areas to write about. The session today is about a topic that relates really to all of us, which is what and how to write in disaster medicine. The need for writing in this area is paramount at this point. I think we all understand that, and that the responsibility to fulfill this gap is really on all of us. Delivering the session today is Professor Hassan Murad. Dr. Murad is a professor of medicine at Mayo Clinic in Rochester, Minnesota. He completed residencies in internal medicine and preventive medicine and is currently the program director of the preventive medicine program at Mayo Clinic. He has taught for many years at the Graduate School of Medicine, at the Mayo Graduate School of Medicine, the graduate courses for the master's students, including the evidence-based medicine course and the systematic review and meta-analysis course. He leads the Mayo Clinic Evidence-Based Practice Center, Mayo EPC, which is a part of the federal designation of the Agency of Healthcare Research and Quality, AHRQ. He is an epidemiologist and a methodologist who aims at improving the methods of translational research and integrating the best available evidence in medical practice. Dr. Murad has conducted systematic reviews and meta-analyses and evidence synthesis studies for many years, and he is an international figure in this field. He has participated in developing clinical practice guidelines with many professional societies and institutions nationwide, including and beyond the borders of the US as well, including the CDC, NHLBI, WHO, Society for Vascular Surgery, Endocrine Society, Pediatric Endocrine Society, American Association of Blood Banks, American Neurological Association, American College of Chest Physicians, Undersea and Hyperbaric Medical Society, and the American Society and the American Association of the Study of Liver Disease. Dr. Murad has published over 300 peer-reviewed scientific papers. We are extremely happy and grateful to Dr. Murad for being with us here today to talk about this very important area of academic writing. I think Dr. Murad can hear me.
Yes. So, sound is okay?
Yeah, sounds perfect.
Great. Thank you, Faris, for the generous introduction. So today our topic is research and publishing during disaster time. And my outline starts with why would you publish or write about disasters? What types of research can be conducted in this setting? And then I will give you some examples from around the world and then move to focus on the Syrian crisis. The discussion here is focused on recent unfortunate events and disasters and conflicts. I did not include examples from older tragedies with large casualties, such as the Holocaust, slavery, Native Americans, or other large unfortunate historic events, because these are viewed now in the context of historical trauma. So I'm focusing on more recent things. So why do it? In the bottom of this slide, you see an email. So for people viewing this session in a non-live manner, please email the contents of this slide to this email. There will be 3 repetitions of this email. So why do we do it? Why do we care about publishing during disaster time? There are 2 reasons, and both reasons are extremely important. There's what we call altruistic motivation. Altruistic motivation means that you're doing things not for yourself. So to publish about disaster, you draw attention to the disaster. So the world has moved on, and for example, the Syrian crisis has been going on for 4 or 5 years, and the world has moved on. No one really cares as much about the crisis. It comes on the news in a very casual and insidious manner. So drawing attention to the disaster is important. The second reason could be to mobilize international public opinion to support relief effort and resolution of the conflict, to get help, and to advance science. So in the time of disaster, there could be new hypotheses developed, There could be new strategies that can be developed and implemented and proved to be effective. Also to enhance public health responses, so people can learn from one disaster and apply their experience into another one. So there are many reasons in which writing on disaster and analyzing disaster and disaster responses can advance science. And also in most research, the source of data comes from developed countries. You don't see a lot of large randomized trials coming from the developing countries. You see it mostly coming from the developed world. So this will be a shift in the source of data, where actually data will be derived from the developing world and provide insight on biology in this part of the world that is not as fortunate. So all these are examples of altruistic motivation. So again, if you don't know what the word altruism means, it means doing things to not benefit yourself, but to benefit others. So that's the first reason why you want to write in this time. The second reason is, of course, is a self-centered or egoistic motivation. So you write so you can publish, so you can improve your CV, so you can get a spot in the match. So you're doing this for your own self. So not that there's anything bad with that. I think both reasons are very important. You want to write and publish in these times for yourself in a self-centered manner, but also for the larger cause, which is the altruistic or the public motivation. So what types of studies and publications are possible in such time? Here's an example from the Bosnian War, and you can see that this is a letter to the editor discussing the overwhelming damage to the infrastructure and social relationships in that area, and call for the need for reorganizing the healthcare system and take care of the remaining thousands of refugees scattered throughout the country. So this is from the Bosnian disaster or massacre that had about 150,000 to 200,000 casualties. And this is just a letter to the editor that expresses someone's opinion calling for action. So that's one type of publication that you can consider writing at this point. Here's another one. This is titled Airborne Field Hospital in Disaster Area, Lessons from Armenia and Rwanda. So Armenia, 25,000 to 50,000 casualty, Rwanda, 500,000 to 4,000,000 casualties. And this is the type of the design here is a retrospective study. It's a retrospective description of deployment of improvised volunteer-based military field hospitals, which was feasible within 24 hours after the decision was made to launch this effort. So this is, again, is a retrospective description of that effort. Here's another piece, lessons from the 2004 Asian tsunami, nature, prevalence, and determinant of prolonged grief disorder among survivors in the South Indian coastal villages. This is a cross-sectional survey among the 2004 tsunami survivors in 5 tsunami-affected coastal villages in India, 9 months after the tsunami. Casualties between 200,000 up to 280,000, or even close to 300,000 people. So this is a third study design that's possible, which is a cross-sectional survey, either during or right after an event. Here it was right after. Here's another example, which is a review article, The Epidemiology of Lethal Violence in Darfur, using microdata to explore complex patterns of ongoing armed conflict. This is a review article describing and analyzing patterns of violence and evolution from just casual incidents into organized violent activities. Casualties, 300,000 people. So all these disasters you can see have this massive, unfortunate loss of life. Writing a review article here can serve the purpose of providing a timeline of how violence escalates. So the authors thought that that would be helpful to people encountering future similar unfortunate events. So I'm going to move now to a Syrian focus, but if you want to summarize what I have said so far, I've given you examples of letters to the editor, review article, retrospective study, and a survey. So with a Syrian focus, if you type in PubMed Syria chemical weapons, so if you just type these 3 words, you get 16 hits. These 16 hits also fall in the same categories that I described earlier. So you have an opinion piece, which is a letter to the editor or a commentary, 12 out of these 16. You have a basic science or a physiology lab experiment in 1 example, and then you have 3 review articles. None of these papers were actually by a name that suggests a Syrian author, which is unfortunate, I think, and strange to some extent, but it's not surprising considering the destruction of the infrastructure and the displacement of many physicians out of their residence. So you can see there are 16 pieces here written on chemical weapons, and they fall in the same pattern of what we've demonstrated earlier. You don't see a randomized controlled trial, for example, because that requires a lot of resources and infrastructure that is not available during crisis time. This opinion piece is something I would like to focus on because I think it's very important. An opinion piece, again, means a letter to the editor or a commentary. It's important, and it has different goals than traditional research. So if you look at the Syrian publications on the Syrian crisis, so you can see opinion pieces that are reflections. Like, for example, this one is The Fog of War from Lancet Respiratory Medicine. So it's a reflection on what happened and having an analogy with respiratory diseases. That's what the fog word here has to do. You can see opinion pieces that have the characteristics or the orientation towards saying, what can we learn? So it describes certain things that were done and what can we learn from them. Here's an example which is titled, What Can We Learn on Medical Preparedness from the Use of Chemical Agents Against Civilians in Syria? Annals of Emergency Medicine. So that's the second goal of an opinion piece, is what can we learn? The third one is calling for action or asking for action. So lest we forget why the use of chemical weapons must not go unchallenged. This is the Canadian Medical Association journal, and that's a high impact journal as well. So this is the third type of, or the third goal, that why you might want to write an opinion piece, to ask for action. Next is original data in a letter. And the example I put here is field hospitals in Syria in the Lancet from last year, where original data, so this means that data you collected, whether it was through a survey or through record review, but it's original data and it's placed in the form of a letter because it's a small amount of data. It's not enough for a larger manuscript. It probably has a descriptive design, so it can be easily published in a letter as opposed to a full manuscript. So here I presented to you 4 goals of just a simple commentary or opinion piece. One is to reflect. The second is to provide lessons of what we have learned. The third is to call for action or ask for action. And the fourth one is to provide original data in a letter. If we just type Syria in the Lancet, so this is only the Lancet, we see a lot of hits. I mean, you see 919 hits, and you can see the distribution over time increasing. And you can see some of the examples here. 4 years of the humanitarian tragedy in Syria, who cares? So this looks more like a reflection. Contaminated vaccine death, a serious setback for Syria. This is a public health focus, and so forth. I'll focus on this article. This was a brief article. The author is here in our group. And you can see an example of what I mentioned earlier, where you provide original data in a letter. So this is a summary of individuals treated in 4 field hospitals in Aleppo, and it just shows the distribution of injuries. Next is another example that is very unique and innovative. This actually is a systematic review, a systematic review of social media and YouTube and Facebook and all other sources of social media. It's very innovative because the authors here actually did a systematic review of these social websites and looked at videos of people who suffered from chemical weapons exposures, and then they reported on the symptoms and the management of these patients. So it's quite interesting, I think, and it's quite unique. So that's another example of a study design that you can potentially do in the time of crisis. So YouTube here was the main source of data. You can see that there was an inclusion criteria. So it was a rigorous systematic review that has specific inclusion criteria. The review of the videos was done in duplicate, which means 2 independent people have evaluated the quality of every review. So these are the classic steps you see in a systematic review. They describe the symptoms of sarin exposure, and then they describe the preparedness efforts. And you can see this was published in the Annals of Internal Medicine, high impact journal with large reach and very large readership. This is just an example of the table from that paper, where it shows the demographics and the clinical signs and treatments of the people who were exposed. You can see this is a classic table 1 that describes characteristics of patients and the unfortunate symptoms and management. And then this is table 2 from that study, where it provides key elements of preparedness, and it shows the assumptions of how preparedness should be undertaken, and then the characteristics of the attack. So this table falls in the line of lesson learned as well, and it provides recommendations to future attacks, if you will. So I really think highly of this paper. Now, what should we write about in Syria? So I gave you a lot of examples. So things that just come to mind if you think about it: chemical weapons use, manifestations and management. So not a lot has been written about it. I mean, I showed you in PubMed there are only 16 that showed up. There should be hundreds or thousands of things written about chemical weapon use. So this is an area, I think, where you can target your effort. You can talk about emerging infectious diseases. So contaminated vaccines is a very unfortunate thing. Return of leishmaniasis, that's another very unfortunate thing. So infectious diseases that people here have forgotten and they only see in textbooks are unfortunately coming back in the developing world. and disaster time is when these unfortunate infections will pop up again, and describing the course of these infections is something very novel because people now don't see it anymore. Talking about public health infrastructure such as water safety, transportation issues is very important. Talking about the healthcare infrastructure or medicine infrastructure, so talking about field hospitals, as we saw some examples, talking about targeting medical personnel is a very unusual, unheard of phenomena. Talking about what happened to the existing healthcare infrastructure, I think is also very, very important. Talking about mental health consequences, so post-traumatic stress syndrome, depression, anxiety are things that are very common to people living in disaster zones and war zones, and these things stay with people for a lifetime. And describing the unique characteristics for these mental health issues in patients in disaster zones is very important and critical, because these people may require different treatment than a classic depression that you may encounter in clinical practice elsewhere. And then you can talk about disease-specific issues, for example, dialysis. So what's going on with dialysis now in patients inside Syria, and how do they get their dialysis? Management of asthma in the context of all the explosions and the pollution and contamination of the environment, what happens to people with asthma. So you can have a disease-specific focus that you can address in your piece. For those following, here's the email below. Please send the content to that email to demonstrate that you are attending. So I'll give you here just a couple of slides of some tips, and I will then end this talk. In terms of journal selection, you want to go with journals with international perspectives, such as the Lancet or BMJ. It's not typical to go to a journal that is not doesn't have that perspective. So, for example, JAMA is probably not, although JAMA may publish something, but it's not the place where I would go first. I would go to these journals with international perspective. The second type of journals would be public health journals. So American Journal of Public Health, International Journal of Public Health, Journal of Preventive Medicine. These all have the public health perspective, and they'll be very interested in your work. The third type of journals, there will be disaster medicine journals, and I listed here 4 of them. You can see these are journals specifically dedicated for this type of publication. They actually have the name disaster in their name, each one of these 4 journals. Fourth is infectious disease journals. There are many of them, and I think any of them would be good for a letter or a commentary or a retrospective study that comes from a disaster zone describing an infectious disease. And lastly, disease-specific journals. So, for example, this piece was published on the Syrian conflict. It says assessment of the end-stage renal disease system and response to hemodialysis need during a humanitarian and medical crisis. So this was published in Kidney International, so it's a disease-specific journal. So in terms of journal selection, to summarize, you can go with journals of international perspective, you can go with public health, you can go with disaster-specific journal, infectious disease journals, and then disease-specific journal. Another tip is you need English language editing. I think that's critical because that will facilitate the peer review process and the acceptance, and sometimes pieces that are poorly written will be screened out or eliminated at the very beginning. So English language editing from someone who's published before in English or can write English well. I would adhere to journal instructions from the very first time. So look at the author instructions, look at how many words they want, how many references they allow, how many authors they allow, and try and stick to these from the very first time. This also will avoid you getting eliminated right from the from the get-go. And then I strongly encourage you to write short sentences and minimally use commas, columns, and semicolons. I see a lot of long sentences that I always edit out from people who are either speak English as their native language or don't. In general, I think the smarter you are, the more you reflect and think, you tend to write long sentences because that demonstrates your process of thinking. However, that's very difficult to read. So just cut the sentences into shorter sentences. And I was looking at some of the other talks that were provided in this course through the SAMS course, and a lot of them talk about some of these writing tips. So I'm not going to go through a lot of them, just like talking with active or writing with active voice versus passive voice and other tips. But the one that I would like to highlight here is writing in short sentences. So in summary, we talked about writing in the time of crisis that is highly important. And I mentioned 2 reasons why you should write in this time or during these times. The first one is altruism, which is the public interest, the interest of science, the interest of the people that you serve, your intention to help them. That's all falls under the altruism, doing things for the safety of others or for the benefit of others. And you have the second interest, which is a self-interest or self-centered interest, which is also a good reason to write. There's nothing wrong with having more publications. So you can see that you balance these 2 reasons. Both of these are compelling reasons why we should write during the time of disaster. Low resources, so you can see all the examples that I showed you. None of them probably required funding. They're very low-key, low-resource mission. You can see that you can reach high-impact journals, and the importance of reaching high-impact journals is not just to publish, but to actually get your word out to resources with large readership that can disseminate your word to larger audiences. And it's not only high-impact journals, but it's also high-impact work. And again, for the purpose of altruism or self-interest, it's high-impact because it may lead to something. It may lead to a change. It may lead to saving a single person's life. So whether you look at it from an altruism perspective or a self-interest perspective, it's a very important and high-impact mission. Thank you.
Thank you very much. This was a very informative and encouraging talk. Thank you, Dr. Murad, for such a nicely structured presentation. We hope this would help people know where and how to start in writing in a positive and constructive manner about this ongoing human catastrophe. There's a grave need for action regarding this globally declared biggest human suffering of our time. The least we can do, I think, is to write about it, as Dr. Murad suggested, either to shed light, push for action to end the conflict, and alleviate the suffering of the millions of humans. Thank you again, Dr. Murad, for being here today, and thank you all for attending or viewing later.